Welcome to Save Your Money, Save Your Teeth. It's Jan with you as always, and today, as always, I'm joined by Dr. Clifford Yudelman from OptiSmile, and we are here once again to bring you the podcast where curiosity meets dentistry, and it's straight from the experts, ready to take a deep dive into the world of dental care, especially from a consumer's perspective. And today, Dr. Clifford Yudelman uncovers how acid reflux, often silent, can wear away your enamel, and why this matters even if you don't feel the heartburn, and also how to protect your smile. Let's get started. But firstly, let's welcome Dr. Yudelman. How are you, Dr. Yudelman?
Hi, Jan. I'm feeling great. Very happy to be back on the podcast. I believe it's number 73 this time. So great subject. This is something that we see actually pretty often at the practice or in dental practice, and it's often undiagnosed. So, it's a silent culprit. A lot of dentists, if they haven't had the training, are not really trained or don't look out for this. And it's something that I bring up often to patients, and it turns out that we help them in more ways than just with their teeth. So the questions today, I think, will uncover a lot of interesting information.
Definitely. And I want to start off by asking you, how does acid reflux actually lead to dental erosion, even when the patients don't experience the typical symptoms?
So the symptoms we're talking about are gastroesophageal reflux disease, known as GERD or GERD. Which almost sounds like you're burping, but
yeah,
you got GERD. Have you got GERD? Yeah. So up to 60% of people with dental erosion have got silent GERD or silent gastroesophageal reflux disease, where the acid regurgitation occurs without heartburn. So people who have heartburn know that they've got heartburn because it's bloody sore. But these are the types of people we're talking about that regurgitate acid into their mouth, usually in their sleep, which we'll come up with now, and they're not aware of it. So the stomach acid that comes up is, I know it sounds gross, I hope nobody's eating while they're listening to this, but the pH, we've spoken about pH before when we speak about cavities and diet and dental erosion. But anything with a pH below 7 is acidic. So 5.5 is the cutoff, that something of a pH of 5.5 or 4.5, or lemon juice, which is like a 3, you're starting to get more and more and more acidic in logarithmically, like in hundreds. It literally goes up 10-fold each time, or 100-fold. It's really a lot more acidic. A 3 is a lot more acidic than, a 5. So you can imagine stomach acid has got a pH as low as 1.5. That would burn your eyes. I mean, that's very strong acid, and as soon as it touches the tooth, it demineralizes or melts the tooth. It dissolves your hydroxyapatite crystals, which is what your teeth are made up of. It's called hydroxyapatite, calcium and phosphate and fluoride, etc. And nighttime reflux is especially harmful because you've got reduced saliva flow during your sleep, and then the acid just sits on the teeth. And frequent low-level regurgitation, which is common in obesity or pregnancy, can also accelerate enamel loss without any obvious symptoms. So we'll see that in patients who've had multiple pregnancies, someone who's had maybe 3 or 4 children in a row and had this regurgitation, or even morning sickness, which is another. We did speak about these things before, but it's a similar process.
Okay, and which teeth surfaces are most vulnerable to the stomach acid?
Normally it's the palatal surfaces, or your upper teeth, the inside surfaces of your upper teeth, because the acid comes up and it sits on those back molars, and even behind your upper front teeth. And then the biting surface of your molars, especially your lower molars. The lower molars will show where the acid pools up on the floor of the mouth during these reflux. And then also gum line areas can erode. And then you get progressive erosion. It's called cupping of the cusps, like a smooth, glossy appearance on the enamel, where instead of points, you got these little like craters in the top of the teeth.
All right, and is there any way that we can distinguish acid reflux erosion from other types of tooth wear?
Yeah, for sure. So erosion from reflux makes your teeth look sort of rounded and glazed, whereas attrition, which is tooth wear from grinding your teeth, they show sharp, flat surfaces that are sort of shiny. The bottom molar and the top molar have a flat surface that meet, whereas sometimes with erosion, the back teeth are melted to the point where the back teeth are not even touching. And then abrasion from brushing looks like a V-shaped notch at the gum line, which is unlike acid erosion, which is much broader and more shallow, sort of more dished out. And then also we spoke at one point about abfractions, which is from clenching and grinding. They also look more like V-shaped notches at the gum line. This kind of erosion is more, it's a bigger surface of the tooth. And you get a combination of these, which is reflux plus grinding, which is even worse. And then the patient history, so linking symptoms of an acid taste. The people that complain, they come in, they say, oh, I wake up with like an acid taste in my mouth, or a croaky, like a horse voice. The one patient came in and he said, when I wake up, I'm feeling a little hoarse. And I said, don't worry, I won't report you to the SPCA. I'm not sure if we can leave that one in.
Yeah, absolutely. Absolutely. Yeah. As long as we don't reveal his
like
wife's
jokes.
Yeah. It's great. I love it.
I woke up feeling a little hoarse. Yeah, I won't repeat the bad joke.
No, thank you.
Yeah, so if a patient says that to me, then I try and keep a straight face and say, oh, maybe you got acid reflux. So yeah.
Okay. All right. So very interesting. I just learned something there. I didn't know that you could actually tell it apart and actually see what kind of tooth wear you have, whether it is acid reflux erosion or something else. That's very interesting to know. I also want to ask you.
Yeah, well, I mean, I've been doing this 42 years. So I'm getting the hang of it.
Exactly.
Now, so, yeah.
I also want to ask you, what warning signs should our patients look out for at home?
So if you get like new sensitivity to cold or sweet foods, especially behind your upper front teeth, I think there'd be other symptoms before that one comes along. But that, like if it's something new and all of a sudden, the back of your front teeth, which is a very unusual place to have erosion, if that starts getting eroded, unless you're eating too many lollies or grenadilla lollies on Clifton Beach, that will also, get behind your upper front teeth and erode those. We have done podcasts about that type of stuff, so I'll stick to the subject. But one of the things is a persistent sour or acidic taste in the morning when you wake up. That's often what people complain of because they think of the dentist, like something's going on. It tastes like metallic or sour. When the teeth start getting thin and more translucent or see-through at the tooth edges, that could be a telltale sign because the teeth are kind of melting and they're getting thinner and thinner. And then as the enamel gets thinner, the dentine underneath is more yellow, and patients will come in and say, oh, my back teeth look more and more yellow. And then you look and a lot of the enamel is already gone and they're already down into the dentine.
Okay, and how do we confirm reflux-induced erosion in the clinic? Can you tell us about your process?
Obviously, we do a 1.5 hour digital clinical exam. We document the location and the severity of any erosive lesions or erosions. And we take intraoral photographs. And we used to do study models, but these days it's a 3D scan. And we can do what's called not a progress scan, they call it time lapse or the Invisalign Itero. And we superimpose one scan digitally with another, and then it shows up like a heat map, or you got yellow, green, red, you got different areas with a scale, and we can see how much of the tooth is missing over a period of, say, a year. If any, maybe it's previous loss and the patients had treatment and they no longer have further loss. And then we refer patients to a gastroenterologist to have a gastroscopy. Yeah, it's very important to see a gastroenterologist for for a colonoscopy when you get to, I believe, when you get to 40, because colon cancer is very preventable. If you get a colonoscopy when you're supposed to, and you have polyps, they remove them. Those polyps turn into cancer, as far as I know. And a lot of patients don't think to also get a gastroscopy, which is where they put a pipe down the other end and just check that those valves and everything in your stomach, you don't have a stomach ulcer. So, yeah, it would definitely be a gastroenterologist that would be the best doctor to help with this kind of issue.
I'm just thinking now, before, I don't want to go off a topic, but I'm just thinking, often they talk about models and models with eating disorders, and then they say they don't have any back teeth left. Is this because of all the acid?
Yes, that's the same thing. And that actually gives me a good idea for a podcast we can do, especially on bulimia and diet and maybe some other issues similar. So I'll pencil that one down.
Awesome.
We have spoken about pregnancy and how morning sickness, and we've spoken about acid, but I've never heard that about models not having back teeth, but that would be from bulimias where people make themselves vomit, and
absolutely,
it's the same really as having reflux.
The stomach acid shouldn't be there. Yeah, I guess that's if it's a long-standing thing, it would definitely erode your teeth. Okay, so now we're talking about diets and lifestyles. What changes can best mitigate acid exposure to the teeth when it comes to your lifestyle and your diet?
I would try eat as early as possible. You don't want to lie down within 2 hours of eating. Eating like fried and fatty foods definitely can make it worse. You want to limit your acidic foods and drinks like citrus fruits, and adding insult to injury. If you already have damage and problems from acid, you want to really avoid any carbonated drinks. Coffee can be acidic. You want to sip on some water after you eat or drink these acidic foods. You can elevate the head of the bed a little bit, put a couple of bricks underneath the back part of the bed, not all four. It's not for the tukolosh in this case. It's for, when I grew up, I was very scared of the tukolosh. Yeah. My nanny, I was brought up in Johannesburg in the 60s and 70s, and my nanny always told me the tukolosh was going to come and get me if I didn't behave, and it worked.
See,
I just put my bed on bricks.
You actually had your bed on the bricks? Oh my gosh, I can't believe it.
No, I'm just...
Are you joking?
I'm maybe not being... I don't think I'm not being politically correct. It's a true fact. It actually happened.
Yeah.
Yeah.
Okay, well, that's very interesting, eh? We learn something new every day.
Yeah.
All right, so...
But in this case, you just put blocks of wood behind the back part of the bed.
Yeah.
And I've never tried it, but apparently that helps, yeah.
All right.
And obviously keeping a healthy weight and avoiding like very tight clothing that increase the pressure in your stomach, that could help.
Okay. And then which preventative measures beyond brushing now help strengthen enamel against acid, doctor?
So a lot of dentists might use high fluoride varnishes or gel, professional applied fluorides. I don't, in our practice, do a lot of that. I think chewing sugar-free gum can, with calcium and phosphate, there's some special gums, but just even chewing a bit of sugar-free gum can reduce the acid in your mouth. Rinsing with a neutral water after any exposure to acid. And then there's something special. It's a casein phosphopeptide amorphous calcium phosphate, CPPACP. Try and say that fast. But basically, that's that tooth mousse that we've spoken about before as well. Tooth mousse or MI paste. And for me, that's the main one instead of all the other things I mentioned above. You rub some of this on your teeth before you go to bed, then you swish it as well, then you spit out and you leave it on your teeth, and that hardens your teeth. It's like a conditioner for your tooth, for your teeth, and that will harden your teeth. It's made from casein, which is like a byproduct when they make yogurt or cheese.
And Dr. Yudelman, when is it appropriate to refer a patient to a stomach doctor?
Yeah, so stomach doctor or stomach specialist is a gastroenterologist. And yeah, if you're seeing persistent enamel erosion, despite optimal dental preventive measures, reports of acid, the acid taste, the chronic cough, throat irritation, if you wake up feeling a little hoarse, failure of over-the-counter antacids. If you're using antacids and they're just not working, you might need prescription medications. And if you change lifestyle habits, like I mentioned before, eating late, eating fatty foods right before bed, all the things we mentioned, I think these are all risks for something called esophagitis, which is there's something called Barrett's disease, and you can actually get cancer of the esophagus or of the stomach, like where that little valve is, if this carries on for years and years, especially in smokers. So it's not just about your teeth, this is about your health.
And Dr. Yudelman, is there any way to restore eroded teeth conservatively and effectively?
Yeah, so that's what we're all about at OptiSmile, is actually using very conservative treatments. So we've spoken about injection molded composite that could work well, resin bonded composite overlays, or in today's day and age, coming soon is 3D printed. We're just waiting for the materials, but injection molding works really well. And then minimally invasive onlays, like with the CEREC. We speak about onlays. I wouldn't start going and having crowns on all of those back teeth. So an onlay would be in a severe case, but normally some bonding or injection molding will work well. And then using a bite plate at night to protect the rebuilt surfaces from any wear. And then coming to see the dentist at least every 6 months, if not every 3 or 4, just to keep an eye on everything.
And then finally, Dr. Yudelman, what is your single best tip for patients worried about acid reflux-related tooth wear?
So if you wake up with a sour taste in your mouth, and you notice any sensitivity, don't wait. See your dentist for an erosion assessment. Maybe ask for a referral to a gastroenterologist. What I love about being in South Africa, I've been back here 10 years, you don't have to get your GP to send you to a specialist. Generally, specialists will see you on a self-referral. So you could find a gastroenterologist yourself. I know I'm probably not giving the best advice, because normally the gastroenterologist will then want to send a report to your GP, and if you don't have one, well, then they're going to be looking after you directly, which in some cases is not a bad idea. And then, early detection, it helps us to protect your enamel before you have more irreversible damage. So see your dentist, brush your teeth twice a day, and see your dentist every 6 months. I think that's how the jingle goes.
And yes, that's it for another week's Save Your Money, Save Your Teeth. Dr. Yudelman, thank you so much for joining us and for sharing all your knowledge with us.
Thank you so much, and looking forward to seeing you next week. We've got a great subject tomorrow. We often get people mention things about your biome, which is the bacteria that live in your body. And so if you're interested in microbiome or biome or anything to do with bacteria, and you're one of these people that eats sauerkraut and drinks kimchi and all of that, then maybe next week will be one for you.
Looking forward to it. Thanks, Doctor. And you remember, if you suspect that acid reflux is harming your smile, you can book a 90-minute digital consultation with the detailed scans, x-rays, and a tailored plan at OptiSmile to diagnose and protect your enamel. Just visit optismile.co.za, or you can send a WhatsApp to 071 140 0396. We'll keep those details in the description of the podcast as well. And also to our listeners, thanks for joining us. Remember to like and subscribe. And remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. Until next time, keep your smile strong.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.